Most people think of not going and having a hard movement as constipation, so I think that would be reasonable. Constipation could be one time a week. We would say that probably people should have a movement at least a few times a week. Your diet's really important so that you can keep the stools moving along very well. And certainly the lack of soluble fiber, the lack of regularity in their eating habits, the people that skip the breakfast, that only have a big dinner, fatty foods, and probably the biggest reason is that we're all dehydrated. People don't drink enough water. And I would say at a minimum, discounting any sort of alcoholic or caffeinated beverages, which will cause you to go to the bathroom, urinate more often, therefore putting you into a negative fluid balance. We would say net about 6 to 8 glasses minimum a day of water. I mean, we have conditions called idiopathic constipation, where people have constipation despite doing all the right things from a dietary point of view and a lifestyle point of view. Of course, there are medical conditions that can cause constipation. You could have a low thyroid condition, hypothyroidism, that would probably be the most common. Pregnancy, actually, it is not a disease, but it certainly, because of the hormonal changes, can cause constipation. And then you have to look at patients' medications. You know, if you take, for example, pain medications, they will slow your motility down. Even some of the anxiolytics, medicines used for anxiety, which are very common these days, and as well as that for depression. So you have to look at the medications too. If you see blood after a bowel movement, this could be simply from a hard stool. And when you pass a hard stool, you may tear the tissues there. Now, you can cause a deep break in the anal tissue, and that's called a fissure. And fissures can bleed significantly. More importantly, they really hurt. Or you could have some bleeding from the scraping of some hemorrhoidal tissue, but not necessarily have a lot of pain. It is not normal to have rectal bleeding, and rectal bleeding is really an alarm symptom that warrants some degree of investigation. People do complain about constipation on vacation or when they're traveling, and they're in an environment where perhaps they're dependent on being served water, so it's really quite different, and they have to remind themselves, you've got to drink your water and you've got to have the fiber. And some people will actually travel with fiber supplements and make sure that they have their own water with them.